We welcome here Professor Peijing Rong. Professor Peijing Rong is the director of the Institute of Basic Research in Clinical Medicine of the China Academy of Chinese Medical Sciences. She is an expert on the use of transcutaneous auricular vagus nerve stimulation as a treatment for preventing various different diseases. Over the past decades, she has put forward the concept of ear treatment of angelopathy and developed a new principle called acupoint peripheral nerve brain network whole regulation of body function. She also developed a novel auricular vagus nerve stimulator device and applied it to epilepsy, depression, insomnia, and mild cognitive impairments. Professor Rong?
Yeah, I'm here. Thank you for
Nice
your
to see you
introduction.
again.
Me too. Thank you. Nice
You're
to meet
welcome.
you. Okay, shall we start?
It's not night in Beijing. I see sunshine and sea behind you.
Thank you. Okay, can you see my slides? I
Yes.
shared my screen with others. Okay. Dear Casantina, dear colleagues, my name is Peijing Rong, who come from China Academy of Chinese Medical Science. It is my great honor to present our studies, which titled Anti-inflammatory Effects of Transcutaneous Vagus Nerve Stimulation, a promising strategy for disease prevention. I will give in the following four aspects. In the first century AD, the Roman physician Celsus the first systematically defined the four clinical symptoms of inflammation: redness, swollen, heat, and pain. Acute inflammation actually is a self-protective mechanism. When tissues suffering extra injury or pathogen invasion, the inflammation activates repeatedly through a series of physiological procedures, including widening blood vessels to increase blood flow, allowing immune cells and nutrient substance to move out of the blood stems and into the damaged tissue, clearing harmful factors and promoting tissue repair. However, when acute inflammation fails to resolve normally, it can become chronic, low-grade inflammation. The condition contributes to serious diseases like cardiovascular disease, type 2 diabetes, Alzheimer's, and even some cancers. Regulating inflammation to prevent this transition is a major challenge in modern medicine. This naturally leads us to the vagus nerve, though its vast distribution network throughout the body. The vagus nerve not only perceives changes in inflammatory status of the body, but also regulate inflammatory response through neuroendocrine immune regulatory networks. When inflammation occurs, vagus nerve afferent fibers detect local signals and relay them to the CNS. The CNS then activates efferent fibers, releasing acetylcholine targeting alpha-7 nicotinic cholinergic receptors, expressed on immune cells. This interaction inhibits pro-inflammatory cytokine such as tumor, the TNF alpha, and interleukin 1 beta, producing anti-inflammatory effect. Based on this, the anti-inflammatory effects of vagus nerve stimulation are validated in animal models involving multiple inflammatory disease, such as RA, inflammatory bowel disease, and sepsis. Clinically, vagus nerve stimulation show sufficiency and safety and for stroke, neural recovery, RE, and inflammatory bowel disease. Neuroanatomy reveals the auricular concha is the area that auricular branch of the vagus nerve distributed. Furthermore, we find that the distribution area of vagus nerve in the ear shows a consistency with the visceral corresponding distribution area of ear acupoint in traditional Chinese medicine. By stimulating the region, TaVNS activates vagal pathway similar to implantable vagus nerve stimulators. TaVNS has been approved by FDA for various diseases in clinic, including depression and migraine and epilepsy. Compared to traditional vagus nerve stimulation that requires surgical implantation, TaVNS offers some advantages. First, it is non-invasive, avoiding surgery risks and suffering. Second, it is easy to use, making patient to accept it and cooperate. Third, it is safe with virtually no serious side effects. Fourth, it is cost-effective, lowering treatment expenses. And finally, it is reusable, making it ideal for long-term management of chronic conditions. Inflammatory responses play an important role in the pathogenesis of depression. Research has found that depression patients often exhibit obvious chronic low-grade inflammatory studies with significantly evaluate low levels of pro-inflammatory factors such as TNF alpha, IL-1 beta, and IL-6 in their serum. Exposure to inflammation leads to changes in neurotransmitter and neurocircuits in the brain associated with depression. Blocked of inflammatory cytokine can alleviate depressive symptoms. In 2021, our team published research in Journal of Neuroinflammation first confirmed that the interaction between alpha-7 alpha NH receptor and the NF-kappa B signaling pathway is the core molecular mechanism mediating TaVNS central anti-inflammatory and anti-depressive depressant effects. In chronic stress model, TaVNS restored depression-related behaviors, improved weight gain, sucrose preference, and reduced immobility time of FST. More importantly, alpha-7 NH receptor antagonist in experiments inhibition abolished therapeutic benefits. At cellular and molecular level research, we found that TaVNS activates alpha-7 NH receptor on the surface of neurons and glial cells. The suppresses NF-kappa B, reducing gene expression and protein synthesis of pro-inflammatory factors such as TNF-alpha and IL-1 beta, while increasing anti-inflammatory factors such as IL-10, rebalancing pro-inflammatory and anti-inflammatory factors. Additionally, TaVNS also modulates microglial activation. Further research results were published in CNS Neuroscience and Therapeutics. This study focused on the hypothalamus, a key neuroendocrine regulatory center, revealing mechanisms by which TaVNS exerts anti-inflammatory effects at the hypothalamic level. The research found that the alpha-7 NH receptors NF-kappa B signaling pathway consists another important molecular mechanisms pathway for the TaVNS to exert anti-inflammatory and anti-depressant effects. Western blot results show that TaVNS increased the alpha-7 NH receptor, decreased PJAK2 and PSTAT3 in rat hypothalamus, inhibited NF-kappa B, P6-5 nuclear translocation, and reduce IL-1 beta levels. Meanwhile, immune influence released TaVNS inhibited microglial hyperactivation and reduced IL-1 beta release from microglia. We further discovered that TaVNS elevated inflammation, reduced depressive syndromes by regulating peripheral and central inflammatory factors, as well as NF-kappa B signaling pathway. This finding indicates that TaVNS exerting synergistic anti-inflammatory effects, suffering tenuously at both peripheral and central levels. This research was published in Frontiers in Immunology. We also focused on the effects of TaVNS on hippocampus, a brain region involved in emotion regulation. the transcriptomic technology was used to analyze TaVNS regulatory effects on hippocampal gene expression profiles. The research found that the CMS model caused significant changes in expression of 2020 genes in the hippocampus. After TaVNS, abnormal expression of 315 of these genes was reversed, mainly involving metabolic and immune-related pathways. This suggests that TaVNS may improve depression-like behaviors by regulating this pathway. Continued research found that CMS inhibited glycolytic pathways and activated inflammatory responses. After TaVNS, metabolic pathways were activated, while expression of inflammation-related genes was inhibited. The regulatory effect not only restored metabolic function, but also enhanced expression of neurotrophic factors and cell proliferation-related genes. Prefrontal cortex dysfunction is linked to depression. Our research focused on the PFC found that metabolic disorders induced by high-fat diet activate P2X7 receptors in the PFC, subsequently activating NLRP3 in inflammation, leading to massive release of pre-inflammatory factors such as L1 beta, ultimately causing depression-like behaviors. TaVNS inhibit this inflammatory cascade reaction, reduce inflammative activation, lower pro-inflammatory factor levels, thereby improving depressive syndromes. Beyond depression, we also focus on on other inflammatory disease. Functional dyspepsia is a common gastrointestinal functional disease with complex pathogenesis inducing gastrointestinal motility, abnormality, vessel hypersensitivity, and chronic inflammation. Our research published in International Journal of Surgery showed that TaVNS improved gastric motility and visceral hypersensitivity. Based our team, other teams have also explored TaVNS anti-inflammatory effect, systemic lupus is a typical autoimmune disease. A randomized double-blind control trial study published in Annals of the Rheumatic Disease in 2022 found that patients treated with TaVNS showed significantly decreased pain scores, obviously improved fatigue levels, and significantly reduced serum substance P level. Sepsis is a systematic inflammatory response syndrome caused by infection with critical condition and high mortality. The core pathological mechanisms of sepsis is uncontrolled systemic inflammatory response leading to multi-organ failure. Open-label, double-blind controlled pilot study published in Brain Stimulation in 2023 showed that TaVNS regulate patients' inflammatory response, reduce level of pro-inflammatory factors such as TNF-alpha, IL-1 beta, and IL-6, while increasing level of anti-inflammatory factors such as IL-10. And though the systematic review above, we can see the TaVNS significant anti-inflammatory effects in diverse conditions from psychiatric disorder like depression and anxiety to digestive system disease such as functional diabetics to autoimmune disease like systemic limbic and acute crucial illness like sepsis. TaVNS has demonstrated significant anti-inflammatory and therapeutic effects. To active is a complete translation from laboratory to clinic. We still face several key challenges. And first, long-term safety and efficiency assessment remains insufficient. Most current studies focus on short-term effect, and we urgently need to conduct large-scale, multi-center, long-term follow-up studies to systematically evaluate the safety and sustained efficiency of continuous or intermittent TaVNS application for monthly or even years. Second, in-depth elucidation of action mechanism still needs improvement. My presentation is concluded. Thanks for listening. Question are welcome. Thank you.